Hi, my name is Michael Morgan. I'm a craniosacral therapist and instructor of craniosacral therapy for the Upledger Institute. Today we're going to talk about craniosacral therapy, how it works, and give a brief little demonstration of its principles. Hi, well, we're here doing a little demonstration of craniosacral therapy, and my very beautiful assistant, we're just looking at the top part of her head and neck and upper part of her body to give you an idea of what we're going to do. Basically, one of the things we do in craniosacral therapy is we allow the tissue to be softened, so there's more fluid exchange, and it allows the tissues to open up and literally almost breathe and feel like there's more fluid exchange. One of the more popular things that we do, which is very complementary to chiropractic, is to look at the cranial base. That's the junction between the head and neck, and come in and lift in with our fingers and allow the head to kind of drop on its own once we kind of nestle into this area and soften the tissue. And for many people with headaches and migraines and even nausea from headaches, this is a wonderful crowd pleaser. So I'm doing this here with Kathy because she's just been on reg bri, so we're releasing some tension after 25 miles of cycling. You don't have to have anything wrong basically to have craniosacral therapy, but people do come for specific techniques including headaches and migraines, any nervous system disorder, vestibular problems, digestive problems, a whole laundry list of things that, and even with children, problems in terms of child development, even stemming from birth. So there's a whole laundry list of things that craniosacral therapy can address, both at the head and in the torso, down even in the legs. I just happen to be working in this area. So what we're doing in her case is, with my fingers, I'm just softening the tissue and allowing the head and neck to become more relaxed. And if there's any restriction in the head or neck, then it prevents fluid from flowing freely from the head down to into the chest, the thoracic inlet. That can cause headaches in and of itself. So I'm just releasing this area very, very nicely, and you can see your breathing change a little bit and some softening. And basically, a craniosacral treatment might typically take about an hour, where we'll start even at the sacrum, work up to the head, and attend to specific areas as needed. Part of what you're doing also with craniosacral, you're looking, as the name implies, at the cranium. You're looking at the forehead or the frontal area of the head and relieving pressure there. It's very beneficial in terms of relieving pressure on the cranial nerves. Also, you're looking at the parietal bones. You're looking at this area called the sphenoid, which is a key area. If you can do a release on this area, a lot of times this can help with immune system dysfunction, hormonal problems, a whole laundry list of other dysfunctions. So I've worked on anything from menopausal problems to differentiation in cycles to just plain things being off in the head that could even stem from the hips. A lot of times you'll work on the temporal bones here. I'm working on a little bit. This can help with vestibular problems, even with kids with attention deficit, people as well as balancing problems, having problems even hearing, even being able to process information in a comfortable way. So this can smooth out a lot of tension in this area. And then again, even in this area, we can work on the jaw, work on the TMJ, which is a real stress buster, and allow tension to be kind of dropped away from the jaw where there can be problems. And then if I were to show you how we continue this treatment down the torso, we'd also address the respiratory diaphragm and the pelvic area and release the whole body, so there's really a flow of energy and fluid from basically the feet up to the head. So that's a little bit of a summary of what we do. Usually, again, it takes about an hour to do, and people come with very specific complaints, but also craniosacral is just good in terms of maintaining well-being and keeping the body more youthful. So that's our little mini demo. Thank you very much.